Hi, I'm Dr. Nona Aoka, clinical oncologist working in the DR Congo. I would like to thank the Royal Society of Medicine for awarding me the 2019 Vanessa Moss Prize. Now, let's go to the presentation.
Well, the title of my presentation is Clinical Characteristics and Treatment Modalities of Prostate Cancer Patients at Ocean Road Cancer Institute. This is the outline that we're going to follow. Prostate cancer is the most frequently diagnosed cancer of men, and incidence ranking puts Africa fourth after Oceania, America, and European countries. Incidence and mortality are correlated, but Africa is the exception, with the mortality from prostate cancer being the highest. As far as clinical characteristics of prostate cancer is concerned, the data in East African countries is rare, and at Ocean Road Cancer Institute, the number of new cases is increasing every year. Our broad objective was to describe the clinical characteristics and the treatment modalities of prostate cancer patients at Ocean Road Cancer Institute between 2014 and 2017. Specifically, we were looking for the socio-demographic and disease characteristics of the prostate cancer patients attending Ocean Road Cancer Institute. We wanted to know the treatment modalities of those prostate cancer patients and evaluate the 1-year survival of the patients. This was a cross-sectional study in which we reviewed the files of prostate cancer patients who attended for the first time Ocean Road Cancer Institute from the 1st of January 2014 to the 31st of December 2017, and a convenient sample of 106 files were reviewed. Now, let's see the results. About the age, you can see here that 43% of the patients were between 60 and 69 years old, and 36% between 70 and 79 years old. This next graph shows that close to 70% of the patients came at stage 4. And as you can see here, 61% of the patients came with widespread metastasis. About the disease symptoms, we clearly see here that more than half of the patients consulted with urinary symptoms. The treatment intent was palliative in 91% of cases. 46% of patients benefited from surgery, only 7% received chemotherapy, and 33% received zoledronic acid. Hormonal therapy was given in 87% of the cases, and only 21% received radiotherapy. This next table shows that close to half of the patients, 48%, did not survive the first year. Now, let's discuss some of the results. Our mean age is 71 years, with a range between 50 and 95. This is similar to what is found in other African countries, such as Uganda, Burkina Faso, or Togo. It is also close to what is found in Japan or Great Britain, but in this last case, the age of detection can go as low as 42 years old. 67% of the patients consulted at stage 4. Literature shows that in Uganda it is 90%, but only 4% in Japan. Some studies are showing a high proportion of advanced stage of prostate cancer in African American men in the US, which is suggesting a genetic cause. The mean PSA for our study is 305.28 nanograms per milliliter. Much more is found in Burkina Faso with close to 750 nanograms per milliliter, but only 80 nanograms per milliliter in Spain. 49% of our patients survived the first year. In India, it was 64%, but in countries such as the US or France, the 5-year survival approaches 100%. So in conclusion, this study shows that close to 70% of patients consulted at stage 4. The treatment intent was palliative 9 times out of 10, and almost half of the patients did not survive the first year. We recommend screening in some situations for early detection of prostate cancer, and multidisciplinary collaboration, especially oncologists, urologists, and surgeons, as they are the ones who most of the time see the prostate cancer patients, and it is very important to consider palliative care training for health care professionals in our settings. These are the references that we used for our study, and in the name of the Polyclinique du Millénaire de Kisangani, we are saying thank you very much
for your attention.
That is it for the presentation. Thank you very much for your attention. I would like to thank the Princess of Jordan for being there. I apologize for not being there myself because of some circumstances. And I thank again the Royal Society of Medicine for awarding me the 2019 Vanessa Moss Prize. Thank you very much.